Okay, folks, first thing I'd like to do is introduce ourselves. We are your hosts. This is Doug Chapman. He's president and CEO of National Group Marketing. And myself, Rick Thornton, business development, National Group Marketing. First of all, you may need something to offer your clients that's a little bit different than your supplemental plans. And here it is. I'm going to ask you these questions. Are your clients always saying, I can't afford a supplemental policy? Health insurance is too high. What about when you actually go to see them? Are they hoping that you will replace their major med with your supplement policy? Sometimes I have clients that think that the supplements is all that they need. Would you like to be the hero that can give your clients an alternative to their major med? And would you like to make high advanced or earned commissions selling a different product along with your supplemental plan? Well, here we have it, folks. Let me go over this in detail. And this is what we will cover in this comprehensive video. What is the value to the client with this plan? How to use this product alongside what you currently sell to enhance your sale. And what is the value to the agent when marketing this plan? Now, what are the benefits to the client? This policy is a very high indemnity plan that can be used for catastrophic events and doctor's office visits. We have double and triple indemnities built in. Why not use your current policies as one of those indemnities? And this plan can be sold year-round as a group plan and or as an individual policy. And the price is 1/2 the cost of a major med. Now, I'm opening up the curtain. What are the intangible benefits to the agent? Able to give clients an option to their major medical while using the agent's current products to enhance the sale. Able to reduce the client's total cost of coverage, thereby increasing the additional amount that they can spend or save on your insurance, on your supplemental insurance. And this product will open a flood of referrals from your clients to their friends, and the agent will be paid handsomely for his or her efforts. Now, what are the policy benefits? Now, this is what we've done. We've taken a 58-year-old male, a 56-year-old female, non-smoker, in 75067, which is a suburb of Dallas, Texas. And we've taken the premiums and we've compared them. Now we've got POLIC. POLIC stands for Philadelphia American Life Insurance Company. We have a $785.67 premium. Now this premium here does include our supplemental insurance, which is some other things that we'll go over in just a second. This one does not include our supplemental insurance, but it is a base premium where you can add your supplemental insurance. Now, over here, if you notice, the major med is $1,218. Now, I'm not going to give you the name of the major med, by the way. Network. We've got a PPO network, and this major med here has an HMO network. Deductible, we have a $7,500 deductible, whereas their deductible is $7,400. We have a doctor's office visit benefit of $160 per visit with 20 visits in a calendar year. And over here, we have a copay of $50. Out of pocket, well, we don't really have an out of pocket, and I'll go to that in just a little bit because of the way the plan works. However, the out of pocket over here with this major med is $8,150. Commissions. Now, with this plan, if you're getting advances and if you're selling all of our supplemental products together in one premium, then the total commission advance on this premium is $2,828.41. However, if you're selling a base plan and you want advances, then the advance is $909.43. Where over here with this major med, it's only $60.90. And here's some footnotes. And patient will not pay deductible for outpatient procedures performed under general anesthesia. And there's a $3,000 first day admittance benefit, which means this deductible here is actually about $4,500. This is based on our preferred plan or 3 units, and we'll show you that in just a little bit. And this, again, I'm going to reiterate this. This is a $2,884.41 for a 9-month blended advance, which is about $235.75 as earned in months 10 through 12. And then over here, if you're selling just the base, it's $909.43, and it's $101.05 with months 10 through 12. Now, let's recap the benefits of this policy. Again, we've got a $785 premium versus a $1,218 major med premium. Now, what's in it for the client? Premiums are 45% less than the major med. There's a $7,500 deductibles that apply only to inpatient stays, and there's a $3,000 admittance benefit. $160 benefit for doctor's office visits, and you get 20 a year. A $50,000 of critical illness insurance. Now, this is where you guys come in. This is what you would not be adding to your policy. You would also not be adding this $4,000 of accident coverage. Or $1,500 for dental coverage. I expect you to use your supplemental insurance for that. It pays the first $800 for an emergency room. We have a large national PPO network. Plan increases annually based on age only. And plan pays multiples of the RV, RBS, or the Medicare physician's fee schedule to doctors, in addition to the daily room payments of $7,500 per day for ICU. Now, I'm giving you the high end right here, which is $7,500 a day for ICU. But if you're just in for a sickness, it's actually $4,500 per day. Now, what's in it for the agent? It's very easy to sell. It's a quick and easy application. There's a 9-month advanced blended commission on 30% of premiums then paid monthly. Now, of course, again, this is blended, and this is using all of our supplemental plans together when you're selling that. There's a 9-month advanced commission on 20% of premium then paid monthly when you're just selling our base plan. Payday is every Tuesday and Thursday, folks, and they don't miss that. Quarterly bonuses and free verified leads targeted to business owners based on production. And you can recruit and train agents and grow your agency. And we have company trips based on 18-month production results. So if you hit the number, you automatically go on the production trip. It's not like the first 30 top agents and that sort of thing. Everybody goes. Now, who should get this plan? Now, here are some of the good candidates. Now, healthy individuals, people on COBRA, self-employed, between jobs, people who have out of control premiums, people who need a PPO, and people in need of a lower deductible. Also, keep in mind, if you're selling groups, this plan is guarantee issue. So some of these don't matter. Here's some poor candidates over here. Women needing maternity, and I tell people that up front. People receiving a subsidy and cost sharing for their major med. People with systemic pre-existing conditions, and people on costly meds. We have here Doug Chapman, President and CEO of National Group Marketing. Doug, can you tell us a little bit about yourself?
Yeah, Rick, thank you. I've been in the health insurance business, major medical, individual primarily, for over 35 years. Hired and trained thousands of agents and worked with virtually every major medical carrier in the country. And in 2011, even before then, we noticed this trend of these traditional major medical policies continuously going up 10, 20, 30% per year, while deductibles were getting larger, which means benefits are coming down. So paying more every year for less benefits with no change in sight. And when 2011 came out in the ACA, they cut everybody's commissions. We were forced with that and the decrease in value of these policies to look at a different business model. And that's when this policy came out. So we've been selling for 10 years.
Doug, what was your success with this product?
We've made, frankly, in my 35 years, in the last certainly 8 to 10 years, made more money I've ever made in my life, and our agents have too. We lost a lot of agents with the ACA because you couldn't make a living. Those agents are coming back and building new homes and making 6-figure incomes, some of them 7-figure incomes with this product because of the great value, the great commissions, the great rate stability, and more importantly, the value to the client. They're building clients and making great money doing it.
You have mentioned the value proposition several times. What is it that you believe to be the value proposition here?
Here's the concept. These consumers do not need to be paying tens of thousands of dollars a year in premiums and deductibles and co-insurance and co-pays and admission charges to have quality health care. What they need is quality health care and a means to fund it. Well, with our products, it's called a health and income protection package, a package of products what pays all of their healthcare needs, surgeries, doctor visits, labs, x-rays, chemotherapy, you name it. But we have no deductible for 95% of our claims. Unless you're hospitalized, there is no deductible. Everything is first dollar. The premiums are half the cost of your lowest major medical policies. So when you cut the premiums in half, put that money back in the consumer's checking account, when you eliminate the deductible and co-insurance from 95% of the consumer's medical bills, that consumer has a $20,000 head start before they ever go to the first doctor visit. And obviously we pay doctor visits first dollar. They need rate stability, which we do. The average rate increase is less than 3% a year. And the products are outstanding, much better than any traditional major medical.
Okay, Doug, if the hospital charges less or if the doctor's office charges less than what the plan pays, can you give us a little scenario of how that works?
Yeah, Rick, great question. This is a defined benefit plan. It is a high-end defined benefit plan. It pays a certain defined amount for any medical procedure you could possibly have. And we have double and triple indemnity benefits, and many times the consumer actually gets an overpayment. That's called an excess indemnity. So this is a consumer-driven product. It's a very different business model than your traditional major medicals. The major medicals, the consumer does not care or know what anything costs because they have a deductible and co-insurance to meet. They get penalized if they go out of network, so they're controlled by the major medical carriers on where they go. They always have to meet their deductible and co-insurance first for the majority of their claims. With our product, it's a consumer-driven product. We make it a consumer intelligent, give them the PHCS network discounts they get instead of the major medical carriers. So as long as our consumers shop just like they do everything else in their life, which we help them shop for good rate, good benefits, their plan many times pays far more than the actual bill is. So if you go to a doctor visit that's traditionally $120, we pay $160 for a doctor visit with no copay.
And the difference goes back to the
exactly.
client.
Now, if that consumer stays in network, that $120 doctor visit will be repriced down to between $60 and $70. They receive that discount at the point of service, which means they will get $100 in that scenario excess indemnity. The $60 or $70 will be sent
right.
to
Now, they're not actually making money off the product.
They're not making money off the product. They can't do that, but they can receive the excess indemnity if they become wise
because
shoppers.
That's a contractual amount
that is
that
the
has
contract
to go out.
amount.
Right.
We will only send the PPO discount on contract to the doctor if it's $70. If it drops from $120 to $70 and we pay $160, we'll send the $70 electronically to the physician, and the consumer will receive whatever excess indemnity the contract pays.
Right. Now, you've got an example of that, and I'm putting an example on the screen right now to give you some idea. Doug, can you tell us a little bit about this example we have on the screen now?
Yeah, I had a shoulder surgery, severe shoulder injury in Lake Tahoe, Nevada on a snow ski trip. and came back and ended up having complete reconstructive surgery on my shoulder. Went here down the street here at a brand new state-of-the-art surgery center. My surgeon was nationally known surgeon for shoulders. He was with the New England Patriots for 15 years. I went to a PPO network provider, which is a state-of-the-art surgery center here in Dallas called Supplemental. And when I went in there and had my outpatient surgery done, it was repriced, as you can see, from I think it's $11,900. It was repriced to $4,100. That's how huge the discounts are by owning your own PPO network, which we provide for the consumers. So when I went to this PPO network, my deductible was waived. I have no deductible since it's an outpatient surgery. And the plan was repriced, and my indemnity paid $6,700 more that I received a check on my excess indemnity, which $6,700 actually more than the hospital charged.
On that one particular accident, what was the total you made? Because there's some more checks you received.
Yeah, I had the accident policy in addition to this, which was another $4,000. And I stayed in network on my MRI, and I picked up another $150 in excess indemnity on my MRI. So on this surgery with a traditional major medical policy, where I would have been out $9,000 to $10,000
in deductible costs,
in deductible and co-insurance,
right.
And the major medical would have got the repricing, not me as the consumer. We turned that around. I'm the consumer. I got the repricing, not the insurance carrier. So it's a consumer-driven, teaches the consumer how to shop, and the consumer can be benefited by the excess indemnity.
Okay, Doug, tell us a little bit about some of the agents who are selling this product and how they're doing.
It's real exciting, Rick. When the ACA came out and they cut everybody's commissions by 60, 70%, there are hundreds of thousands of agents left the industry. Some of them stayed behind to sell the ACA, but I met several of those guys that were selling the ACA, making $18,000 to $20,000 a year, struggling with the major medical. When I took them over and they came on this plan and got their head wrapped around this different business model, then these guys are making six-figure incomes easy within a year to 2 years. And obviously the rate stability at less than 3% a year increase, they've grown their account significantly by several hundred clients a year. And the average shelf life of this product's generally 7, 8, 9 years, so residuals really add up. And the clients are very happy. They don't have deductibles to deal with, and the great value.
Right. So what you're saying is the agents are doing pretty well now.
Agents are doing very well, building new homes, sending the kids through college. The careers are exploding because this is a business model that's working, great value to the consumer, and a great opportunity for the agent.
Okay, Doug, is it anything else you want to comment on?
Well, just this, it's just a great income opportunity, but more importantly, it's a movement across America where we're changing lives with this healthcare product.
And we're helping a lot of people.
We're helping an awful lot of people. Yeah. So we're making a lot of money, no question about it. But we're helping a lot of people. It doesn't get any better than that. Helping people, saving folks money, making them good money at the same time.
Thanks, Doug. If you're interested in getting contracted, you will see a contract link at the very end of this video. You'll also see an email from us that will have agent testimonials and a little bit more about the product.